So today's event is going to be advocating for you and your loved one in healthcare. And in different sessions that we've hosted in this chapter, as well as in different follow-up surveys, we always send those surveys as part of that follow-up email within 48 hours of an event's conclusion. One of the questions that I ask is, what are some future topics that you would be interested in? And in almost every single one of those surveys throughout this past year, I've gotten, I need tips on how to better advocate for myself. I need tips on how to be a more empowered patient in a doctor-patient setting. I think we've talked about this in the past in our actual meetings, that doctor knows best culture is pretty national, and though it's sort of working its way out, we tend to get intimidated. I know I do when I'm sitting in front of a doctor. The doctor's been to medical school and they know so much. But we are the ones that know our bodies the best, and when we are there for our patients, that we're care partners to, we know them really well. We know when they're off. We know when they're not feeling great. We know when they're not saying something that they probably should be saying or bringing up. And so for that reason, we wanted to talk about today advocating for you and your loved one in healthcare. And we've invited Reina Weiner, who's an author and myeloma patient, and she's going to be talking to us, sharing her thoughts about her book, Trust Your Doctor, but Not That Much. I have it here, Trust Your Doctor, but Not That Much. I have to admit, if you're familiar with the Myeloma Crowd community programs, I always talk about what events we have upcoming in the future. And this week we had several events with doctors who would stay on even after the presentation was over to hear those outro announcements. And every time I would talk about, we're going to have a session this week where we talk about how to trust your doctor, but not that much, they thought it was so funny. They completely agreed. Please trust us, but not that much. Be your own empowered advocate. So I loved their response to this topic, and I'm really excited for you to hear from her. I won't spoil everything, but basically just to set up the meeting, in this book, she talks about how to be your own healthcare advocate, or in our case, as caregivers, how to be a great healthcare advocate for our partner or our parent, perhaps, in my case, my grandmother, and what we can do for ourselves as well, because as we've talked about in the past, we need to keep going to the doctor. It's not like we have to neglect our own medical care. So we're kind of navigating two medical care settings when it comes to being a care partner. She also gives different tips throughout the book, such as setting the tone of a doctor's visit. I'm not going to go into too many details. I wrote a couple more here, but I decided, you know what, let's have Reina talk to you about it. It is my absolute pleasure to introduce Reina to you. Reina S. Weiner is a healthcare and patient advocacy coach, a former national oncology trainer, nursing instructor, multi-book author, and cancer patient in remission. Her most recent book is Trust Your Doctor, but Not That Much. Be Your Own Best Healthcare Advocate. And her previous book is entitled Strong from the Start, Raising Confident and Resilient Kids. Reina is the why wait, trust yourself, and ask for what you need woman. When she's not working on all of the above, Reina can be found on the back of her husband's motorcycle on a warm and sunny day. And she can also be reached at reinaweiner.com, and we'll share her contact information with all of you at the end of this presentation. So Reina, the time is now yours.
Wonderful. Thank you. Thank you, Audrey and Maria and everybody who's joining us this evening. It's great to be here and to help you with some tips on how to encourage yourself to advocate for somebody that you care about very dearly. And so I started the presentation with basically begin at the beginning. So if we could see a slide, that would be lovely. Otherwise, we'll just talk about it. Good. And really, I think this is important for everybody, whether you're a patient or a caregiver, to know as much as you can about the illness that you are dealing with or the particular patient is dealing with. And this, we're talking about myeloma, but you can, if you're a young person, you might be advocating for your children. You might be advocating for your parents or a partner or a spouse. So the the preparation for the visit is really an important part of advocating, because if you go in with some knowledge and you're able to have what I always call a conversation, you speak, the doctor speaks, or if you're seeing, excuse me, a nurse practitioner or a PA, the medical person who you can speak with and listen to, if you have done a bit of homework, makes you a really more effective advocate. So if you can, and you can use HealthTree, because HealthTree is a super duper duper great resource for you to find out everything that you really, need to know. And that puts you in a very, the word powerful comes to mind, a powerful position. So, and it's important for you to know, not just the patient, but both of you to go in to a visit with a physician or a phone call. Now with COVID, there's a little more Zoom than there used to be previously. But whenever you are contacting or communicating with a healthcare professional, try to know what you can. You don't have to know what they know, because you didn't go to medical school, as Audrey said. You don't have to be there. What can I say? You haven't had the education level that they have, but you certainly can be knowledgeable and well-informed as a patient or the patient's advocate. So, next slide, please. So the best thing to do really is to advocate, is to be prepared. And I have been talking about preparing for a visit for years. And this is really what I do. And I have my husband do it. Even though he is not a myeloma person, he goes to the doctor for his own issues. And I can tell you that whenever I go and I show up with my list, and then of course I give one to the healthcare professional, sometimes they're a little bit surprised, like a lot surprised. The first time I did it, the doctor asked me if there was going to be a quiz. And I said, well, do your best. I don't know how you're going to do, but do your best. But a little humor, but seriously, write it all down. When you have some time and you can be quiet, you sit down with a paper and a pen or your computer, whatever you're comfortable with. And what questions do you have? Is this how I'm supposed to feel on this treatment? Are there other potential treatments? These are the side effects that I'm having. I'm concerned that every time, I go for a walk, it gives me a headache. Well, does this have anything to do with treatment? Whatever, that might sound a little bit off, the chart, but everybody has a different response to treatment. So it's a very good idea for you to communicate that to your physician and your loved one's physician, what really is going on with you, what side effects are really impacting you, so that it really puts a bit of a damper on your life, sometimes more than a bit, and it can vary, certainly. So what are you dealing with? That's what they need to know. And what changes in your health? Are you having any new symptoms? Has your pain increased? Do you have pain? Has it decreased? And what have you tried? Doctors really like to know that. Well, when my foot hurts, I take 2 aspirin. Doesn't help. Maybe I have tramadol. Maybe I take that. Maybe that's not helping either. What have I tried? Or I've tried this and gee, it makes such a difference. Or I have acupuncture. Or I found out my physical therapist can really help my knee, my leg, my back, whatever the problem is. Is that helping? What are you doing as the patient advocate to encourage the patient to try different types of treatment? I'm not advocating those because I'm not a physician, but I do know that many physicians will support alternative or complementary treatments, and that's something to consider. But really, what you want to let them know is, this is what I'm doing. Has this helped, or has this not been of any benefit to me at all? And also, you want to talk about your mental health. I know that's, people get a little, maybe a little bit anxious to talk about that they do have anxiety, or they do feel depressed, or they're having some insomnia. You know what? I can tell you as a patient, I've had all of them, every little bit of them. And for you to communicate that about your loved one, maybe you see, you're sleeping with your partner and it's 2 o'clock in the morning, they are wide awake and they are frightened, or they're having side effects, or they're having a problem. Physician needs to really know that. And there may be all kinds of ways to treat what symptoms that they're having. So when you prepare and you write down everything, just everything that you can think of, that will do a few things. That will organize the visit so that you make the best use of your time, because your time is valuable too, as is the physician's time. And also, when you show up with your list, and I'll say it in the next slide, there are 3 lists that you show up with. Your list, you as the caregiver, the patient's list, and the list that you give to your doctor. Like I said, sometimes they'll be a little taken aback, oh my gosh, but every time I have done that, or anybody that I have suggested to has done that, it really helps the doctor, and it certainly helps you. And it does, what can I say, puts you in a position of advocate. It lets the physician know that you are going to be involved, that you are going to participate, that you are taking an active part in the care of your loved one. And that really means an awful lot, tremendous amount. So when you show up, like I said, you can write it out, type it out, whatever works for you. Show up with the copies. Everybody goes prepared with their little sheet of paper and they can read it. And the benefit too is that you don't go home and say, oh, for goodness sakes, I forgot to ask about the XYZ that's been bothering me for 3 months. I forgot to ask, because I'm so used to having this problem that it almost becomes part of my daily life. Write it down, write it down, write it down, and then share it. And really, don't be reluctant to talk about that every day your foot swells at 3 o'clock. I made that up. I have no idea if that happens to anybody, but write down everything that may seem insignificant or unimportant, because what I believe too is that I always think that doctors are like detectives. You give them as many clues as you can, and then they go back into the brain, into that computer brain that says, okay, it's not this, it's not this. Oh, maybe it's that. The more information you give them, the more and the better able they are to help, to really help you. So if too you are feeling, I don't know, this is a doctor, oh my gosh, I can't ask him or her any questions because they're so smart and I don't know anything, that is really not true. Yes, they are smart. Yes, they are experienced. They have a great deal of expertise. And as oncologists and hematologists, they have a great deal of heart. And they really want you to be better. So, when you provide them with what they need, you will be helping them. But also, about your own body. Like I feel, I've been living in this body for a very long time. And therefore, I know its little idiosyncrasies. And if you are the caregiver for a partner, you also know the idiosyncrasies of your partner. So don't be reluctant to share anything that you can. And like I said, the more prepared you are, the more you know, the more it becomes a conversation, that you become a participant, that the doctor then will feel, oh, this person really is involved, is able to communicate with me, and they really value that. Like I said, I can't tell you how many times doctors have told me, wow, this is really good. I love this, because I don't have to go back into the chart, look for everything, and say, okay, what did they say like 2 months ago? It's all here. It's all on the paper. So that's what you do with all your questions, and you go over them together. And if you are reading them, that might help you too, because sometimes people are feeling shy, like I said, and a little uncomfortable because the doctor is so smart, and you may feel that you don't know as much as they do. If you read it, then you won't get that nervous. You'll have it down, and you'll be able to look at your notes and say, yeah, this is what I want to say. And what I say too, not me, but the caregiver, it makes sense. It makes sense. So don't be afraid to say, even if it sounds like it's a little out there, it's not. It's really not. It's important. So let's go to the next slide and see what else we have to say. This is Speak Up. When I was first diagnosed back, believe it or not, in 2012, I used to be an oncology representative. So, and I lived in Northern Virginia, and in Bethesda, Maryland is where the biggest research hospital is in the world, the National Institute of Health. And one of the segments is called the National Cancer Institute. And there are something like, I think 27, if I'm right, different disciplines of medicine. But anyway, that's where they do all the clinical trials. That's where they all begin. And you can't go there if you fall down and break your arm. You go to the emergency room. If you want to participate in a clinic, you can only go there if you want to participate in a clinical trial. So I went there. It was great. That's where I got my first treatment. And that was when it was called back then carfilzomib, which is now Kyprolis, dexamethasone, and Revlimid. And that was a phase 2 trial that got the product approved. Nonetheless, there's a big, big sign in there that says Speak Up. You know, it's so big that you can't help but see it. And it is for all the patients to ask everything that you want to know. And what I wrote is, if you don't understand, ask again. And I do sincerely believe that doctors are healers, yes, but they are also educators. And really some of their role is to explain to all of us as caregivers, as patients, and so forth, what the disease is like, what the treatments will do, what our options are, what to expect. And then for us to share with them actually what it's like to be a caregiver or what it's like to be a patient, so that they have the information to use, you know, to help other people, because that's their goal. So they are educators. So don't be shy. Don't be shy. Speak up. That's what they said. And you ask for what you need to know. You know, there's a lot of, listen, there's so much information out there. And with myeloma, thank goodness, it changes. You know, I mean, I knew about this for myself since 1999, and I can tell you how much treatment has changed in that time. But I can also tell you that my husband is my caregiver, and he has gone with me for every treatment, except now more recently, because they, you know, with Zoom, and not with Zoom, but with COVID, they won't let him in. But for years, he has gone with me. And even when I write everything down, and I'm so sure I have it down, one little thing will come up that I forgot. And he will be there and he will remind me. So ask, just keep asking. And like I said, don't be shy. Ask again. And especially if they don't have the answer, maybe they can get back to you. Or if they do have an answer, but they're really not sure that this is the right way to go for you, get back to them. Ask one more time. Always ask one more time. And another thing, if you don't understand, don't be intimidated. Don't be embarrassed. There's no reason to be. Yeah, if you went to medical school and you didn't have the answer, okay, then you have a reason to be wondering why you didn't learn what you were supposed to learn. But for the rest of us who are well educated but not physicians, it's really important to say, you know, I didn't understand that. Could you explain that to me again? And I have asked that question more times than I can remember. And I cannot remember any doctor, or my husband cannot remember any doctor that said, no, I'm too busy, I can't tell you. They will always tell you, because like I said, to be an oncologist, hematologist, you have to have a pretty decent heart, and they do really want to help you. So pay attention to the care that the patient is getting. Is there some improvement? Do you see them getting better? Are they maintaining their health? And this is big. This is big too. Always make sure that they're receiving the right treatment and medicine by the healthcare professionals. Don't assume anything. I have, and my husband has asked sometimes when because I've been getting infusions for a very long time, is this the right medication? If he's not there, I ask. I ask to see the chemo bag. I ask to see what the dose is, and I ask to see if my name is on it, because from previous experience, and even when I had my transfusion and I was a little out of it, my husband asked. So there's no reason why you can't ask. This is your body and your health and your life. So don't be shy. Yeah, and I still ask to this day. I've been on Kyprolis forever. I still ask, can you tell me the dose? Does it have my name on it? Anyway, know what medications that the patient takes and why. Why? Because you are the caregiver. Why are they getting A drug versus B drug? Does it have to do with their heart function, their kidney function, that this drug is approved, that this is not? Why are they getting it? And that is a really valid question to ask. Why is the physician making this choice? And sometimes, as I'm sure you know, people are human. They make mistakes. It happens. It has happened to me. Thank goodness my husband was there, and found out that, you know what, this is not what was ordered. I remember even when my mother was a patient a very long time ago, and she was in the hospital, and that, thank goodness that she was able to help herself, but there was also a caregiver, somebody helping her out too, that there was somebody with the same name, a very similar last name, and she asked if they would move her to another room. The hospital declined. They ended up taking her blood work and confusing it with somebody else. It just happens. It just happens. And so if, as a caregiver, it's really important to physically be there, if at all possible. Now, I don't know, depending on what's happening with COVID, if you can be there. Sometimes now I know they let one person in, one caregiver in with the patient, but depends on, where you go for treatment and how COVID has impacted all of us. But yeah, why is my husband, why is my child, why is my mother on this drug? Is there something else that might be more effective for them? They might have fewer side effects. In my case, they had tried me on another drug that was oral. The side effects to me were intolerable. So we changed. So I let them know right away, and that was not a problem. And also, this is important, the doctor. I'm imagining that most of us go, or as caregivers are aware, that patients need to go to a physician who really specializes in the care of multiple myeloma, because those physicians are the most knowledgeable about the disease. And I think that's really important. And if you're going to a hospital or a clinic, find out what you can. Like on HealthTree, on the IMF and the MMRF, International Myeloma Foundation, Multiple Myeloma Foundation, I think it is, Research Foundation, HealthTree. There's also Leukemia and Lymphoma. They have physicians listed there that are in your area, or if you are in a clinical trial, there are several sites, sometimes there are many sites throughout the country that you may not, but may be eligible for a trial, and start checking things out. Be as knowledgeable as you can, and see how you can help the patient be as well as they can. You can ask me questions, by the way. Anybody can interrupt me. Please say something. How about the next slide? Trust yourself. This is huge, huge, huge. I mean, like the book, when I wrote Trust Your Doctor, but not that much. Some people laughed, some didn't laugh. What are you going to do? But I just decided it's okay. You can laugh. I see that you put up on the screen myeloma. I guess what does it say? I lost it. It was up there. But there are a lot of resources to go to find out what you need to go to get the best information for the patient. But really, this is essential to being a good advocate and a really great caregiver. Is if you feel something isn't right, it's probably not right. If you're having the patient is having significant side effects, the health really doesn't seem to be improving or being maintained, or if some emotional comfort is there, which I wrote about too, that you go to this physician and they're not listening. They are not listening to you. They don't hear you. You have important issues that you need, questions that you need answered, and somebody's really rushing you in and out, or you really would like to have a second opinion, and you sincerely, politely, respectfully ask this particular physician if they would give you a name of somebody, another physician, because you feel more comfortable, because you're being not listened to. That's the first part. But the second, this is having multiple myeloma is a big deal, a big deal. Maybe you have to have some surgery. Maybe you have to have radiation. A second opinion. Absolutely, absolutely, absolutely. And just trust yourself that that's the right thing to do. It is just the right thing to do. And I always feel like, for me or for my husband, who has definitely been my caregiver, if somebody is not hearing me, even if the question, they've heard that question 10 times in one day, because they probably have from other myeloma patients or the other myeloma caregivers, you are the one going through it. Your caregiver is the one who is helping you go through it. And all of you need to feel comfortable getting your issues and concerns addressed. And if you're not feeling it, you got to feel it. Then you need to go elsewhere. And I also think that I wrote there mutual respect, that you respect them, their expertise, their knowledge, and their caring. All that is true. But also they need to respect you, and they need to respect you as the caregiver and the patient going through, because you go through it together. I can tell you, for me, being a patient all these years, I've been in treatment since 2009 years, 9 years. And before that, I had MGUS, I had smoldering. This has been, honest to goodness, 20 years. And my husband has followed it with me all throughout. But the idea that you can treat the physician with respect for his or her knowledge, but they also, it's important for them as medical professionals to listen to you, to treat you with respect, because what you're going through is very real. There's no question about it. And keep trusting, keep knowing that it's okay to ask and ask. And even if you're feeling a little shy, just take a deep breath, do a little, I mean it, like whatever helps, a little meditation, a little, take a ride on your bicycle around the block, whatever kind of brings you down and lets you kind of relax and feel like there's no dumb questions. There are no dumb questions. Doesn't matter. Just trust yourself that this is the right question to ask for someone that you really care about. And they'll answer. They really will. And I always say too, that, if you ask the question in a way where it is presented to the healthcare provider as, I need your help, most everybody responds very positively to, I need your help, because that's what they do. They want to help us. That's their whole goal. So this is, if any of you remember Dr. Spock, who I remember from a long time ago, and I just love this quote: trust yourself, you know more than you think you do. And you do, you really do. As caregivers, you know an awful lot. And as patients, all through the treatment process, because many people, thankfully, have treatment for quite some time. And it's ongoing education and ongoing issues. So trust that you know what you're doing, because you do. You know your body, and you know what feels right, and that you have the opportunity and also the incentive as caregivers to advocate for someone you love. So important. The second opinion, as I mentioned, ask for a second opinion. Myeloma is serious. There are issues that come up for everybody, no matter where the patient is on the journey, and also where the caregiver is on the journey, because they have a lot to learn about the disease, but also about the emotional impact. Always a lot about the emotional impact to the relationship, and to the family and to your lifestyle. Has a great kind of tumble down dynamic to it. But second opinions, always. We even had, I should say, my husband with me all the time, being a caregiver. And when I first started on this myeloma journey, there was a general oncologist who wanted to start treating me. Way before it was actually necessary. But he, as a matter of fact, not even me or my husband, the caregiver, said, I think you need to go to a center that specializes in multiple myeloma. He said, get a second opinion. That, I never forgot that. That was a long time ago. And I went to the Mayo Clinic and they said, nope, you don't need to be treated yet. And from there on, I went to a physician, always with my husband there, encouraging me, say, go to a physician who only does multiple myeloma. And that was really like the path. But the second opinion, most of the time, the physician will not tell you that you need to go somewhere else. But, I have never been to anybody that when I said, I needed a second opinion, or my husband said, you need a second opinion. Don't go, just, go ahead and do exactly what this doctor says. They never reject that. They never insulted. They're professionals, It's like some people won't even go to a different hairdresser because they're afraid, oh my gosh, they're not going to like me anymore. The doctor does not have to love you, but they do need to respect you, just like you need to respect them. So the caregiver should really, part of their role as advocate is to say to the patient who might be a little reluctant, because you start having that rapport with the doctor and then you don't want to leave him. And what if he's angry that you left? And don't worry about their ego. They'll be just absolutely fine. But for your health and safety, your caregiver really needs to encourage you to get a second opinion. And that second opinion does not mean that you cannot go back to the first physician, because maybe the first physician was absolutely on target. He or she was the right person with the right goals for you. But if you get that second opinion that's like right on the same target as the first doctor said, okay, this is cool. If you don't, then you might have to think about it. I mean, there are times when advocates say, I think I should get a third opinion. And people have done that. And, you don't want to get 10 because that confuses the daylights out of you. But sometimes, definitely a second opinion with multiple myeloma, if your questions are not being answered, if you feel like there might be a better treatment out there for you, if the physician is really not listening to you and you don't feel that you're being heard, you can say, Dr. XYZ, or not you. A lot of times it is the patient advocate, your caregiver, saying, you know what, I'm really concerned about how I'm doing. I feel like I would like to get a second opinion, Dr. So-and-so. What do you think? And I think if it's presented in a way that's not confrontational, that is polite, that is pleasant and patient and so forth, then I think that they will say, oh, sure, I don't have a problem with that. And I think you should, really. I think it's just a really smart way to go. Really, really smart way to go. So consider that. And be an empowered caregiver. When you sit down and get everything together, when you're making out your list for the appointment, and you are knowledgeable, you care a great deal about the patient that you're advocating for, you're supportive, but you're also confident in what you know. Because like I said before, many myeloma patients, it's a journey. It's not like one and done. It goes on for a period of time, and over time you learn some more. You become hopefully a little more confident about what you know in order to help the patient. And therefore, when you are an advocate, your loved one has a problem, obviously, with their health, but you're not powerless. Really, you can seek out the best care, the second opinion, asking all your questions, feeling that you're comfortable. You're doing what you can. And for myself as a patient, I feel like I've done what I can. And then after that, what will be what will be. But I can tell you that even with my own past experience working in oncology and so forth, my husband has been a tremendous asset, a huge asset. He's there when I'm having my moments, as I like to call them, when I'm not feeling so confident, when I'm scared, when I'm anxious, when I'm depressed, thinking, oh, one more treatment. I go every 2 weeks, like clockwork, have been going for 9 years. The only time I had a break was when I had a transplant. But I'm very grateful. But point is, he is there with me every time, asking questions, getting to know my healthcare provider really well, going to the same doc for years and years. And I really do believe I couldn't do without him. I really do. And so I leave you with that thought. So thank you for all the caregivers out there. Your input and your support is invaluable. So keep on keeping on, and be really nice to yourself, because it takes a toll on the caregiver as well as the patient. So any questions, please ask.
Thank you so much, Reina. Isn't she fun, you guys? Isn't she awesome? Round of applause for you, Reina. Her contact information is up here. We will include it in that follow-up email that's going to come within 48 hours of the event's conclusion. We do have time, as Reina said, for question and answers. There is that raise hand button at the bottom of your screen. It's just a little hand icon. If you're interested in asking a question or sharing your caregiver experience, we really just open up these last 20 minutes or so to discussion with each other, checking on each other, making sure we're okay. You're also welcome to write in the chat if you don't feel comfortable speaking. But Diane, let's start with you.
I love your talk there, Reina. My husband and I he's 3.5 years in, and he usually has 3 pages of notes, questions, and I try and go through it with him, and we try and pare it down a little bit on things. And then one thing that we really learned that has helpful, he had an appointment today, is we highlight the top 3, like the most important. So come hell or high water, we're not leaving that office without those highlighted questions answered. And there's been times that she's been interrupted and had to leave this doctor. And we just make sure, okay, these 3 are the most important. We may not get through the whole list, but at least those 3 cover it. So I'd highly recommend that, because there were times we'd get out to the car and we'd go, dang it, we forgot that one. So that was
yeah, you know what a nurse practitioner told me, as a matter of fact, who was in the clinical trial with me, to really, like you said, the 3 most important. So try to really stay on target, because then sometimes people are talking about whatever TV show they're watching, what happened with their
our kids,
grandkids, the dog. I had to take the dog to, and I know, people have a life outside of myeloma. I try to, well, like I always say, I make space in my life for myeloma. Certainly a good part of my life, good in the big part of my life, but it's not my whole life. So sometimes it's hard when you know the physician and you've been going there for years to say, so what do you think about this team and what this, so try hard to use your time really very efficiently. So what you do, Diane, is great. Absolutely great. Thank you.
Awesome. Thank you, Diane. Do we have anybody else that wants to ask a question or share an experience? Yeah, it says Casey Sakura. So if you want to unmute yourself using that little microphone button at the bottom. Perfect.
Hi. Yeah, I'm Kathy. My husband and I went to get a second opinion at UC San Francisco recently, and when we sort of knew that he couldn't bring anybody in because it was 2 months ago, and so anyway, but I went with him. And when we got to the waiting room, we asked about whether I could go in. And they said, no, but we can put you in a room with a telephone. So when he's in his appointment, you can listen and talk, So I had copied my 3 pages in the car for my husband. And so I made sure that we went over them, and the doctor, spent 45 minutes with us, and she told us how well prepared we were. But you don't let COVID stop you if there's something that you really think you want. And so that was my tip, and having the 3 pages. But she, getting the second opinion, she practically knocked half the questions out of the water right from the beginning by saying, what are you waiting for? Because we had been with a specialist for myeloma, but he also has AL amyloidosis. And so we asked for a second opinion with the AL amyloidosis specialist. And she was the one that said, you don't need to get your numbers down to 0. If you do your transplant now, you're still healthy enough before it attacks your organs. So it was really fast. Within a month, we were seeing her again, and she said, I have an opening in 2 weeks. Would you like to go? So we had all his tests done in a little over a month, and he got his transplant in 6 weeks from the first time we ever saw her. And he's home now. And we did follow the directions that the doctor said, and said, if it had a fever. So, but yeah, I was in the room with him during COVID. They still allowed 1 vaccinated person. And so we had to go back to the local hospital because of a fever, but now he's doing great. He's only been home for 2 weeks, and he's got his energy and he has no pain. So we're hopeful.
Wonderful.
Hi,
But
Kathy.
Kathy, if I may say something, one time when I went and that was also during more of a COVID epidemic, they said my husband could call, and he sat in the car and he got on the phone, and they did the whole visit like that. And some other people that I know have asked if they could record the visit.
Mm-hmm.
If you have your phone, some physicians, yes, some no, but a lot of them say, yeah, it's okay. You're not putting it on like, TikTok, whatever that stuff is. And that way, if you can't be there as the caregiver, at least you can hear it, and then you can go over it with the patient. So I think you were really smart, and that you copied. Everybody copies all the lists down. Keep copying, keep showing up. It's wonderful. What you do is so, so important to the care and the mental health of to know somebody's there for you is so supportive and so comforting. I can't tell you, from the patient perspective, I know he's always got my back, and that's what I count on. So thank you. Anyway, good. Anybody else?
Thank you, Raina. Thank you, Kathy. We have Bobby raising her hand. Bobby, if you want to unmute yourself.
Okay, there we go. Yeah, just like you said, the telephone, most of my husband's has all been through COVID. He was diagnosed 2 years ago this Thanksgiving. So we just got started, and then in February we went to Mayo's for second opinion, and May 1st we reported to start the stem cell transplant. And whenever I haven't been able to go in with him to any appointments, I have at Mayo's I was able to go, but some of our local appointments, And I just have him call me. I'll sit in the car or whatever. And, you know, my wife's on the phone with me. And sometimes my daughter has been, even we put her on the phone with us too, where she couldn't be there, especially when we were starting the process up at Mayo's. I couldn't see her driving 4.5 hours just for, you know, a couple hours to visit with the doctor. So we would put her on speakerphone, and the doctor was very good about, you know, sure, you know, and he'd ask, do you have any questions? Ask her and stuff. So that is a way around it. But I know that with the COVID restrictions, it's been very trying.
No question. Absolutely. Trying for the doctors, for us, the patients, for the caregivers, you know, all those people. And you know, too, one of the doctors said to me that with the family on the phone at the same time, it does save them some time, because instead of your daughter, your husband, your mother, whoever, you know, having to call after the appointment that you've had, then the doctor has to tell them the same story that they just told you. So if they, and most of them will, allow, like you said, the phone call, the recording, then they don't have to say it one more time. So it's good for them. It's good for you, you know, caregivers, patients. It's good for everybody. So ask and ask and ask. Keep asking.
Great, thank you. Kathy, did you have something to add there?
Yeah, if nobody else. The other thing, when my husband was in the hospital for 3 weeks, and then he came home for a week, then he had to go back in for 4 nights. Both times, if I wasn't getting the answers we wanted to know from the oncologist who just, you know, zipped through the room, some of them did stay a while, but I got on my chart, which the UC systems use, and I'm, you know, lots of you guys have access to your information anyway. And I just messaged the doctor, the oncologist that knew him, and said, you know, what's the deal with this, or can you explain why he's got a blood clot? And when he was in the hospital this last time, the doctor said, we're sending somebody from our team down to see you. So it worked.
Yeah, it does. It really does. And you can use the patient portal for your husband. The caregivers can do that. Well, that is great too. That's absolutely so beneficial. Like I said, it saves time, and it really speeds things up for the doctor, the patient, the caregiver, and so forth. It's really important. I can tell you from the patient perspective, my husband, when I had the transplant, this was before COVID, sat in the hospital with me all day, every day. He was probably bored to death, but that's okay. Been married a long time. It's okay. I think I deserve it, basically. But he was there every day, all day, you know, and it's a couple of hours from our home was where my transplant was. So he didn't go home. He just stayed in some local hospitality house. That was I went to Levine, which is in Charlotte, North Carolina, and there's a hospitality house for patients and family members. And so he stayed there. And I was in the hospital for 16 days. He was there every day, all day long. Just seeing him there was really what I needed, you know.
The other thing that I did while he was at UC San Francisco, because of COVID restrictions, you know, he could only have one visitor, and it couldn't change. You know, you had to have that same visitor, so they knew he wasn't getting COVID from different visitors each day. But anyway, but the visiting hours were from, like, I don't know, 10 to 9 or something. And there was a huge line at 10 o'clock to get in. But you can ask at least in our case, if you ask the doctor if it's okay if you spend the night, then you're authorized to come anytime. And so at the front door, they told me, as long as you come 5 minutes before 10, you can still get in before all the others. And so I didn't have any problem about going and coming whenever I wanted. And I didn't have to stand in the line again.
Hey, that's good. That is, when I was in the hospital, I'm sure there were times, but when you're the patient, you're not really thinking about what time it is, what day it is. It's very little like connection with the outside world. But I got great care. And like I said, he was there for me every minute, all the time. And when I went to take a shower one day and I fainted in the shower, he was there. He was there. And then this is just hope you laugh, is that there was, the emergency cord that pulls, like, to call the nurses. He pulled the cord and it didn't work. So he went out to the nurse's station. Oh, my wife fell down in the shower. She fainted. Well, they came in like in 2 seconds. So, but then they did fix it. But the point being is that there he was, always there for me as needed. And it was very loving. Really, it was so loving and so supportive. And so what you all do for your spouses, your loved ones, whomever they may be, it really counts. So I can't tell you how much it's appreciated. And if you could keep on doing that, that would be the best, just the best. Somebody to hold your hand all the way.
Thank you so much.
We
do have time for one more person to ask a question or share an experience. If anybody would like to volunteer, or we can just, I don't mind waiting until someone wants to share. I see a couple new faces and just welcome. Thank you for coming. You might have come before and I just don't recognize your face, but it's fun to see this group of women here as we gather together. So.
But if your loved one too, just a little like promo for HealthTree and the Myeloma Coach Program, it's a great asset. I have people call me who are newly diagnosed and really so scared and so upset. And also people at crossroads, like, should I get a second opinion? Is a transplant the most effective treatment for me now as change occurs, within medicine related to myeloma? Of course, don't give medical opinions because that's not my thing. But the patient perspective, patient to patient, sometimes helps people because if they see you and you're okay, then maybe that gives them just a tiny bit of confidence in the process. So if you haven't used a myeloma coach, if you ever need it, they're there for you.
Thank you, Reina. I appreciate that. And I did include in the chat as well, and I'll include it in the follow-up email. The link to that free program. We have caregiver coaches. We have patient coaches for your loved ones. So I will finish up with some outro announcements. I really am thankful for your time here with us, and it's exciting to be together. So where did that go? Our next meeting will be on September 9th. The time is TBD, but will probably be around the same time that it was tonight. We're going to be talking about boundaries, learning how to make and keep them for everyone's benefit. This is something that I personally struggle with because I love caregiving, but it can be so heavy sometimes. Trying to balance, in my case, like being a mom and being a wife and working full time and also trying to care for my grandma. It gets really heavy. So I'm excited personally for this. We have a licensed social worker coming to talk to us about how to make and keep those boundaries for everyone's benefit. And we'll keep you updated on that. Upcoming events that you might be interested in. Tomorrow is the Mountain West Myeloma group. This is primarily for people in Utah, Idaho, Nevada, Montana, Colorado, Wyoming, but everybody is welcome. And we're going to hear from Dr. Kelsey Burrell about how to navigate neuropathy, which I know is a very common side effect for our loved ones. Wednesday, August 18th at 3 p.m. is the Connect with the Myeloma Crowd chapter. We will be talking more about that Myeloma Coach program that Reina mentioned. We're going to be hearing from Myeloma Coach Program Director Rosalind Height. She'll be talking about how to create exponential growth within the Myeloma Coach Program. On the 19th, we have our newly diagnosed myeloma chapter. As caregivers, you're more than welcome to any of these, even if they do say newly diagnosed. The whole family really is diagnosed with cancer when someone gets that cancer diagnosis. So please feel free to be invited to any of these. We're going to be talking about understanding those myeloma labs. What are those key indicators that you should keep your eye out for? And what do common results mean? Those can be so complicated when we get them back and the doctor says, here you go, here's your lab results. And we're like, what does this mean? So stay tuned for that one. And then Tuesday, August 24th is our Nutrition and Wellness for Myeloma chapter. We have been talking with experts throughout this year, and the general consensus due to recent scientific studies have shown that a whole food plant-based diet is extremely beneficial to people's health. It's a hard transition, especially because the American food culture is not whole food plant-based. We have people from plant-powered Metro New York coming to speak to us. They're a foundation. They're going to give us recipes. They're going to show us what we should stock our kitchens with in order to make the transition a little bit more easier. It's a practical approach to a healthier diet. Anyway, the link to sign up for those events or even more events that I haven't mentioned are found at the bottom of this slide and will be included in the follow-up email within 48 hours of the event's conclusion. Another thank you to our community event sponsors, Bristol Myers Squibb, Amgen Oncology, Genentech, Adaptive Biotechnologies, Sanofi Oncopeptides, Karyopharm Therapeutics, and Takeda Oncology. Thank you to each of you for joining us tonight as myeloma caregivers, and I hope that you have a great rest of your night. Thank you so much for coming.